Do I need PRP or hair transplant? I had hair fall issues since 2008, 2009, I guess. And slowly and steadily, the density of my hair has gone real down. I had medium broad forehead with good hairline on the sides, but over the years, my forehead has become more broad, and the side hairline has gone a bit deep inside. However, I am not worried about the sides. It's the hair between my head. A complete strip from my forehead right until the crown is falling like crazy, so much that the comb hurts because there are only a few hairs left. PRP or transplant?
Thank you for your question. You've submitted several very good photos of the top of the scalp and different views of your hair, and you describe a situation where you've been losing hair since 2008 to 2009. And basically, you are concerned about this very significant change in thinning and progression, and you're asking which is a better option for you, PRP or hair transplant. Well, I can certainly share with you my approach to situations like yours, which we see every day in our practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I'm also the founder of Trichostem Hair Regeneration Centers. This is a technology that we've developed over several years, which is a non-surgical alternative to hair transplant and does use PRP, and I will certainly share with you, again, our approach to situations like yours. So to begin with, it's very important to understand the landscape of what your options are. And certainly you cover two significant ones, PRP and hair transplant. We should also cover the options of the medical therapies, such as the use of minoxidil and the use of finasteride. Minoxidil is a topical drug that has some potential benefit in terms of prolonging the growth cycle of thinning hairs, as well as to stimulate short-term the growth of finer hairs that help improve coverage. It's topical, it requires daily use, and it however does not stop the hair loss progression, and you can still have continued thinning. But nonetheless, it does have a role. The other drug to consider is a drug called finasteride, better known by the trade name Propecia. This is a drug that's been around since the late 90s, and it is a drug that blocks an enzyme that converts testosterone to dihydrotestosterone. This drug was very popular, and it's a drug that we have used for many years for patients. Unfortunately, people have become very much afraid of using this drug, and it started several years ago, this fear, because of reports in medical literature of long-term sexual side effects after stopping the drug. Now, in terms of hair transplant versus PRP, briefly, PRP, platelet-rich plasma, does have some benefit in hair loss. It does stimulate hair growth. However, in my experience, the results of PRP are relatively short-term. The injection is done, and then you can get a little bit of growth, but then you have to come back typically every month in order to keep pushing the hair to continue to grow. It also doesn't stop progression. Hair transplant, which we have been doing for many, many years, is probably not the best choice for you because you have decent hair density that to the point where if you actually placed hair grafts in those areas where you're thinning, you'll actually lose a lot of your existing hairs. And so I'll now discuss with you, for you the options that we developed in our practice called hair regeneration. Hair regeneration evolved out of our approach to treating patients with hair loss with hair transplant, with the goal of improving outcomes in terms of the grafts as well as the healing of the donor area. And what we use is a material called acellular matrix. This is a material that's for advanced wound healing that actually serendipitously caused thinning hairs to actually get thicker in some cases when we were doing hair transplant. And this was in areas where we weren't actually transplanting. So this became a very interesting thing for me, and I decided to work on developing a process so that I can actually use this as a standalone without hair transplant. We worked on this for several years, and I developed an algorithm and a system. And now what we do essentially for patients like yourself who come to us from around the world is we do a treatment called hair regeneration. It's this combination of acellular matrix and platelet-rich plasma, which is essentially a single episode injection. Now we've added a variable points in time where we might want to do something called, we call it a booster, where we're actually able to improve the growth of very fine hairs that were revived or reactivated when the first treatment was done. And that's usually done around 15 months later. Basically, with hair regeneration, we're able to stop progression, regrow hair that's not growing, and that means the hair follicles have to be present, and there's a certain percentage that are present that are not growing because there is less growth of those hairs because of a prolonged resting stage, basically what's called a prolonged telogen phase. And to stop the progression, as I said, and then to induce the shed of any thinning hairs for the regrowth of thicker hairs. Now, what we have observed, and we have several years of experience, beyond 5 to 7 years, in fact, that 5 years out, 99% of men and women have had improvement and have been stable. We follow our patients very closely, and we see them every 3 months. So we're able to document this, and then we follow them for the duration of 5 years. So it's been extremely successful for us. And I think that someone like yourself would probably be a very good candidate for a technology such as hair regeneration. So distinguish PRP alone from the hair regeneration technology and learn about this method, because I think that it is important to still not completely discount the possibility of using drugs, but I can just tell you that unfortunately a lot of people are so afraid of taking finasteride they just won't take it. And that means that basically they have no option other than to allow the hair to fall, to disappear, and then undergo hair transplantation. We've been able to stop that cycle and help people by doing hair regeneration and getting sustainable results for at least 5 years. So I hope that was helpful. I wish you the best of luck, and thank you for your question.